Right now, without thinking about it, you just took a breath. You do it around 20,000 times a day. You've done it every single day of your life. And according to decades of research in physiology, pulmonology, and human evolutionary biology, you are almost certainly doing it wrong. Not a little wrong, profoundly, measurably, biologically wrong, in a way that is quietly affecting your sleep, your focus, your anxiety levels, your jaw shape, and even how long you live. But how is that possible? How does the one thing your body does automatically, the thing it does before you're even born, become something you've been getting wrong? The answer takes you back millions of years, and it changes everything you think you know about the air in your lungs. Your body evolved in a very specific environment. Open savannas, dense forests, thin mountain air at altitude. Your ancient ancestors breathed through their noses almost exclusively. The nose was not optional. It was the primary air processing system your body had spent millions of years engineering. The nasal passage is one of the most sophisticated filtration systems ever evolved. It warms incoming air to exactly the right temperature before it reaches your lungs. It adds moisture so your airways don't dry out. It filters dust, pathogens, and particles through tiny hairs called cilia. And most critically, it produces a molecule called nitric oxide, which opens up your blood vessels, improves oxygen absorption, and has direct antimicrobial effects. Your mouth does none of that. Your mouth is a backup, an emergency hatch. It evolved for eating, speaking, and for extreme exertion, moments when you're sprinting, fighting, climbing. In those moments, your body needs more raw air fast, and it opens a second channel. But here's what went wrong. At some point in recent human history, and researchers like James Nestor, author of Breath, and Dr. Mark Burhen, a functional dentist who has spent years studying oral and airway health, began documenting this shift. Humans started defaulting to mouth breathing all the time. Not just during sprints, during rest, during sleep, during ordinary afternoons sitting at a desk, and the consequences are not small. When you breathe through your mouth, you bypass everything your nose was built to do. The air that enters your lungs is colder, drier, and full of particles your nose would have caught. Your blood oxygen levels paradoxically can drop, because without nasal nitric oxide, your blood vessels don't dilate as efficiently, and your body absorbs less oxygen from each breath even though more raw air is moving through you. This is called the oxygen paradox, and it is one of the most counterintuitive findings in modern respiratory science. The more you gasp, the less oxygen you actually use. Dr. Konstantin Buteyko, a Soviet physician working in the 1950s and 1960s, stumbled onto something that would take decades for Western medicine to take seriously. He noticed that patients with chronic respiratory conditions, asthma, sleep apnea, anxiety, and were almost all chronic overbreathers. They were moving too much air, too fast, through the wrong channel. His insight, now validated across dozens of clinical studies, was this: your body doesn't actually respond to the amount of oxygen in your blood. It responds to the amount of carbon dioxide. Carbon dioxide is not just a waste gas, it is a signal, a trigger. When carbon dioxide levels in your blood rise to the right threshold, your blood vessels dilate, your red blood cells release their oxygen more efficiently, and your body enters a calm, efficient metabolic state. When you overbreathe, taking big, fast, mouth-breathing gulps, you wash out your carbon dioxide levels and your body actually receives less usable oxygen, not more. Your ancestors didn't need to know any of this. They breathed through their noses. Their carbon dioxide levels stayed balanced naturally. Their bodies ran the system the way it was designed. You took a different path, and the reasons why are embedded in a set of changes that happened over just the last few thousand years, almost nothing in evolutionary time. The first change was food. Your ancient ancestors chewed constantly. Tough roots, raw meat, fibrous plants, hard seeds. All of that chewing did something invisible but critical. It shaped your jaw. The mechanical stress of chewing hard food stimulates bone growth in the jaw and palate. It creates a wide, high-arched oral cavity. And a wide, high-arched oral cavity means a wide nasal passage above it. The nasal cavity sits directly above the roof of your mouth, separated by just a thin layer of bone. Then food got soft. Anthropologists and dental researchers, including Dr. Daniel Lieberman at Harvard, have traced the narrowing of the human jaw almost perfectly alongside the introduction of processed and cooked food. A few thousand years ago, humans had virtually no dental crowding. Every tooth fit perfectly in the jaw. The wisdom teeth came in straight because there was room. Today, roughly 70% of people have some degree of dental crowding. Most people need orthodontic work. Wisdom teeth are routinely removed because the jaw is simply too narrow. A narrow jaw means a narrowed nasal airway. And a narrowed nasal airway means your body, trying to get enough air, defaults to the open path, the mouth. The second change was posture. Your evolutionary ancestors held their heads upright over their spines, in a neutral position developed for bipedal locomotion in open terrain. Today, the average person spends hours each day with their chin jutting forward, their neck at an angle, their head displaced in front of their center of gravity. This forward head posture compresses the airway. It collapses the soft tissue of the throat slightly inward. It makes nasal breathing harder and mouth breathing the path of least resistance. You feel the pull toward mouth breathing. You probably don't know you feel it, but your body makes the choice constantly, automatically, in favor of the easier route. The consequences compound. Chronic mouth breathing in children reshapes the developing face. Researchers, including Dr. John Flutter, an Australian orthodontic specialist, documented that children who breathe through their mouths consistently grow long, narrow faces, what clinicians sometimes call adenoid face, with drooping lower jaws, underdeveloped cheekbones, and dark circles under the eyes. The face literally grows around the airway it uses most. In adults, chronic mouth breathing is one of the primary drivers of sleep-disordered breathing, snoring, upper airway resistance syndrome, obstructive sleep apnea. These are not minor inconveniences. Untreated sleep apnea is associated with dramatically elevated risks of cardiovascular disease, cognitive decline, metabolic dysfunction, and early death. And for many people, the mechanism begins with something as simple as sleeping with their mouth open. During the day, chronic overbreathing keeps the nervous system in a low-grade state of alert. Remember what happens when carbon dioxide drops? Your blood vessels constrict slightly. Your body's interpretation of low carbon dioxide is not relaxation. It is the beginning of a threat response. Your heart rate rises a little. Your attention narrows. Your anxiety baseline creeps upward. The research of breathing therapist and author Patrick McKeown, whose work draws on both the Buteyko method and modern sports physiology, has shown that restoring nasal, diaphragmatic breathing, breathing that is slow, low, and through the nose, can reduce anxiety markers, improve sleep quality, and in some cases reduce asthma symptoms more effectively than rescue inhalers. Nasal breathing, slower breathing, breathing that uses the diaphragm rather than the chest, because there's a third mistake layered on top of the wrong channel and the wrong rate, the wrong muscle. Watch yourself breathe right now. Put one hand on your chest and one hand on your belly. When you inhale, which hand rises first? If it's your chest, you are chest breathing, and chest breathing is the body's emergency respiration mode. It's fast, shallow, and keeps the sympathetic nervous system, your fight or flight system, slightly activated at all times. It is what your body does when you are scared, injured, or about to sprint. Diaphragmatic breathing, belly breathing, where your hand on your abdomen rises first as the diaphragm pulls down and makes room for your lungs to expand fully below, is rest and digest mode. It activates the vagus nerve. It sends a direct signal to your parasympathetic nervous system that you are safe, that you can digest, that you can repair, that you can focus. Your ancient ancestors breathed this way by default. They did not need to practice it. They walked miles. Each day, crouched, climbed, carried weight, and their bodies automatically engaged the diaphragm. Sitting in a chair for 8 hours was not part of the equation. Now it is, and the diaphragm, like any muscle you stop using, weakens. Here's the part that should stop you cold. None of this is irreversible. The jaw, if stimulated correctly even in adulthood through functional orthodontics or targeted chewing, can remodel. Bone is always responding to force. The nasal passage, when chronic obstruction is addressed, enlarged tonsils, deviated septum, chronic inflammation, opens. And breathing itself, the pattern, the muscle, the channel, is trainable in days. Not months, days. Studies measuring blood oxygen, CO2 tolerance, heart rate variability, and sleep architecture show measurable shifts within 1 to 2 weeks of consistent nasal, diaphragmatic breathing practice. Something as simple as sealing your mouth with a small piece of medical tape during sleep, a practice now studied at Stanford and popularized by researchers like Andrew Huberman, has produced documented improvements in snoring, sleep quality, and morning energy within 2 to 4 nights. Your body already knows how to breathe correctly. It was doing it before you were born. In the womb, your body practiced breathing movements with amniotic fluid. The pattern was encoded before your first breath. What happened since then was environmental, behavioral, correctable. Tonight, when you lie down to sleep, notice your mouth. Notice whether it falls open. Notice whether the air moves through your nose or through the gap between your lips. And tomorrow, without thinking about it, hopefully without thinking about it, you'll take a breath. The question is whether this time you'll do it the way 2 million years of human evolution designed you to.